Yes. So basically, there was in 2001, there was a stages of reproductive aging workshop where they gave this classification. Okay. Then STRAW+10 in 2010, they again modified it a little bit. So basically, based on clinical profile, biochemical findings, and ultrasound findings, one can divide the menstrual cycles and this period in a woman between three phases: the reproductive phase, the transition phase, and the postmenopause phase. The reference point for this is the final menstrual period. Okay, so FMP term is important from that point of view. So the final menstrual period, right? So then they gave this -5, -4, -3b, in A, -2. The duration of these will be variable in different patients, right? So in the reproductive phase, the early reproductive phase, the woman is fertile, normal AMH, inhibin, FSH is lower side, basically normal. Then -4, some fertility problems, subfertility may come in, but AMH inhibin are still fine, and FSH is also low, right? So this is like in the 20s and the 30s maybe. Then -3b, 3a, generally, like an aging woman more than 35 now has fertility problems, menstrual irregularities, may start having occasional vasomotor symptoms. And biochemically, you see that AMH is decreasing, inhibin is decreasing, FSH is starting to rise. On ultrasound, the AFCs are decreasing, okay? So these are the advanced age patients who present to us with fertility problems also and menstrual problems also, right? Then just before this stage, the 1 and -2, just before the final menstrual period, more exaggerated fertility, menstrual irregularities. Now VMS have started. The transition period, vasomotor symptoms will start. And on biochemical, now you'll find high FSH, low MH, few antral follicles. So ultimately, they'll have the final menstrual period. After that, the postmenopausal phase. So the initial postmenopausal phase, it's the VMS starting of declining bone density. Now these stages are important to define because you know that you need to start acting within this window, the -2 to +1, right? In the +2A, so more than like 4-5 years post-menopause, now you will have worsening of the genitourinary symptoms, worsening of osteoporosis CVS, although at this time after 4-5 years the VMS may start to improve. Okay, so this is the importance of knowing the different phases, right? So then you can define that patient is still in this phase, what all things I can still change, what all things you have the window of opportunity basically here from the transition to the +1 stage of